Yes. Now let's start with the shoulder joint. Shoulder is basically a ball and socket joint where a ball moves in within a flat cup. So surrounding the ball and the cup there is a soft tissue which we call the cartilage, which actually prevents rubbing of the two bones when we move our shoulder. And surrounding the shoulder there is a group of muscles which we call the rotator cuff muscle, which actually helps the movement of the shoulder. Now what happens with age? Which age there is a degeneration, there is a tear of the surrounding muscles and ligaments, and with age there is a wear and tear of the bone and the cartilage. So what happens whenever someone wants to move the joint, there is a rubbing of the bone against each other, so that causes a lot of pain. So like degeneration in the knee and the hip, the shoulder joint is also liable to undergo degeneration and arthritis with age. When a shoulder joint becomes arthritic, or when the ligaments around the shoulder or the rotator cuff muscles are completely torn, the shoulder becomes very painful and an individual is unable to move or do daily activities of the shoulder. Then we need a replacement of the shoulder joint to get back the normal life. When there is a persistent pain in the shoulder which is not improving with medications and physiotherapy, there is a lot of pain on movement of the shoulder, the individual is unable to do daily activities, pain is waking up from sleep and disturbing the regular normal individual activities, then it's time to visit a shoulder specialist to understand what exactly is wrong with the shoulder and thereby formulate a treatment so that the individual can get back to his or her normal life. No, not all shoulder joint would need a replacement. I mean, most of the shoulder pains would do well with medications, physiotherapy. If there's a tear of the ligament or the rotator cuff in a relatively young patient, then I mean we can do a minimally invasive surgery and repair the ligaments. It's only when the ligaments are torn beyond repair and when the joints are worn out, so that we cannot get back the normal function of the individuals, then only we go for a shoulder replacement. What happens is in elderly it's in the elderly individuals that the joint undergoes degeneration and arthritis. So the bones are rubbing against each other and the ligaments around the shoulder becomes torn or very degenerated, which cannot be reconstructed. So it's mostly the elderly individuals who would need a shoulder replacement. In some fractures where the ball is so much shattered that we cannot reconstruct the ball or fix the ball. So in that case we also go for a replacement of the shoulder joint. Initially after surgery we put the individual in a sling or bag to support the elbow and the upper limb. In a day or two he or she starts gentle movements of the elbow. Say in a few weeks or two she starts doing sort of small regular activities, and with time, with physio, maybe after 4 or 6 weeks, more or less most of the individuals can get back to their normal life, doing light activities, and thereafter it will take some time depending on the individual to get back to completely normal life. Like all joint replacements, be it hip, knee or shoulder, post-op physiotherapy plays a very important role in getting back to normal, because the joints are replaced, but you need a physiotherapy and exercise to strengthen the muscle and ligaments so that your shoulder joint can function normally. Initially the physiotherapy is guided. The physiotherapist visits you, shows you exercises under supervision, you do it. Later on you would be able to do on your own. You should continue the shoulder exercises until you get back the normal strength of your shoulder and you are able to do activities of daily life. Well, almost all individuals get back to their normal life. They can do regular activities, light activities, activities of the normal life, like bathing, eating, combing, doing light activities. Obviously, I mean, in elderly individual, we won't expect lifting heavy weight or going for contact sports. All individuals can get back to their normal activities, light work after shoulder replacement. The most important is they do not have the pain which they were having before. They can have a good sleep at night, and they can perform their activities of daily life on their own. You need to visit regularly, and you need to keep on doing the physiotherapy as advised. So recovery will take some time. So so you require some patience. Follow the structured rehabilitation protocol, and you will get back to normal. The one thing I need to say, it's not that all shoulder requires replacement, but if you are having a pain in the shoulder which is not getting better with medications, physiotherapy, visit a shoulder specialist. At least if we can diagnose the condition earlier, we can treat accordingly. Maybe we can also avoid getting into a condition where your shoulder is bad enough to undergo replacement. Maybe we could do a slightly more simpler procedures, or some other less invasive procedures, so that you can get back to normal. Even if you need a shoulder replacement, there's nothing to worry. After replacement, you'll get back to normal, and you can do activities which at your age you'd require to be functionally independent. Thank you.